So the therapy is going to involve relationship plus work, right? It's not exactly the same as following and leading, but they're related, right? So it's not just relationship. Some therapies say it's all in the relationship, others say it's all in the technique. We're going to combine following and leading. We're going to keep our fingers on the client's emotional pulse moment by moment. So the process nature, moment by moment, is very important. Some psychoanalytic people of cohesion, cohort, self-psychology, they talk about being empathic, but they mean something totally different. They sort of offer summary empathy every 5 minutes or something like that, as opposed to seeing yourself as an information processing facilitator through the empathic process, that I respond to you in this moment that influences your next moment. And I keep my finger on your emotional pulse, not on what you're thinking or behaving, but on what you're feeling. And then we have these different markers and tasks. The structure of a marker is there's a initial indicator, the task marker, a self-critical split. There's a two-chair dialogue where you have the people in two chairs, or the one part criticizing the other part and the other part responding. This is designed to lead to a particular kind of process, which I don't have here, I just have a symbol for it, that there's a process. And if the person goes through the process, then they'll reach an end state, which we'll call a resolution state. So self-critical splits are good to work with two chairs. That will lead to a particular kind of process, which will lead to an end result of self-acceptance. But an unclear feeling, a vague, unclear felt sense, will use focusing, if those of you familiar with Gendlin's focusing, but essentially close your eyes and go inside to that place where you feel and see what you're feeling there right now and try and put words to it. So it's a different process, and it leads to a different end state of symbolizing the felt sense, right? So we have different kinds of tasks. The most active tasks are in enactment, where we use chair dialogues, but that's not all that we do. But then there's a process. This is what's really important. Therapists want to learn, how do I do it? How do I intervene? What you really need to learn is, what's the process of change in clients? That's where the change is taking place. And you want to facilitate that process. I mean, there is, how do I facilitate it? But the important thing is, we've done lots of research over 40 years to delineate the process. Now, I was an engineer, I draw diagrams. Psychologists generally like flow charts, right? But there's a set of steps, right? And on the top row is what the critic goes through, and on the bottom row is what the one being criticized goes through. And we'll go into this later this afternoon. But this is a research-based process, which it's not, do I do two chair works with you that leads to change. It's, if I do two chair work and you go through this process, does it lead to change? Change takes place in the client, not in what the therapist does. So we've shown that when clients go through these steps, it leads to change. So we can think of the whole approach as islands of work on these different tasks in an ocean of empathy. Right? And we have these different kinds of tasks. Right? So this is an evidence-based treatment. Evidence-based is political, not scientific. It's pseudo-scientific, right? I mean, I come from a different frame of reference, so I wasn't indoctrinated into psychology, and really these research studies, which I have done, are rhetoric. They're ways of persuading people. They haven't got anything to do with truth. I like to tell the story. One of our colleagues' husband is a subatomic physicist working on the God particle at NSERM, and their error rate is 1 in 3.5 million. You're shooting atoms, and if you get things, if you're off by more than 1 in 3.5 million chances, you don't have truth. In psychology, it's 5 in 100, right? And really randomized studies require thousands of people to handle that there are no differences between groups. But if you study 30 people versus 30 people, there are going to be 4 difficult people in one group, more difficult than 4 in the other group, and that's going to determine the outcome. So, but it's hard to... Research is about power, about influence, about control, and so on. But it's the best we have, I guess. So that's my little rap about research, right? But we have research too, right? I have a little button, which I won't say exactly, but it says XXXU, we have research too, right? So we do have evidence that what we do is effective with depression, with complex trauma and anxiety, with couples and so on. So there's evidence of effectiveness. But what's really important, and where I think true research goes on, is in trying to investigate how do people change. And so over 30 years of research, we found that moderate to high aroused emotion that's deeply experienced and reflected on to make narrative sense in the context of an empathically attuned relationship, in a good with a good working alliance, with a therapist who's present, predicts therapeutic outcome, right? So each of the ones in blue are research, are measures, right? Arousal measure, a measure of empathy, a measure of depth of experience, right? So I need to use my hands for this. Because this is actually evidence of a theory of change. And it's a theory of change about how to work with emotion. What this is, it's validating, or it's not all the received views of emotional change. One of them is get rid of emotion, right? The cathartic view. Get rid of it, it's garbage. Another is downregulate emotion, right? That's the current DBT, CBT, downregulate emotion. Then we could call it even an attachment view, and is accept emotion, right? There are other views, but what this is saying and what I'm saying is activate emotion and reflect on it to make sense of it, right? So this is the theory of change that we've demonstrated empirically, that when you activate and make sense of, it leads to predict outcome. So one of the things, though, in our research was we knew that arousing emotion was good, but it also could be not good. Our research showed that arousing emotion predicted positive outcome, but that's because our therapists knew how to work with aroused emotion. So then we proceeded in another 10 to 15 years of research to show that actually it was moderately aroused primary emotions, not too much, and we have a measure, that are processed productively. So it's not just that you have the emotion, it's how you interact with your emotion, right? And I'll possibly go into what but productive processing means you allow it, you accept it, you symbolize it, you regulate it. If it's too dysregulated, you differentiate it, but you do things with the emotion. This is also in thumbnail, you bring cognition to emotion to make sense of it, right? So it's not just having the high arousal, it's also approaching it and productively processing it. But then, I'm using terms that I haven't defined yet, we found that it was going through a sequence of emotions from secondary symptomatic emotions or global distress. I feel shitty, I feel bad, I feel anxious, I feel depressed. Going from the symptomatic secondary emotion to the primary painful maladaptive core emotion, the shame underlying the anxiety, the insecure attachment underlying the depression. So we had to help you move from the symptomatic emotion. When I first looked up emotion in the literature, emotion was symptoms. You would get a hit and it would say depression, anxiety. Those are symptoms. They're not actually emotions, they're syndromes, right? So, but underlying the hopelessness of depression, you might find the shame of unworthiness. Right? So if you move from the hopelessness of depression to the shame of unworthiness, to the anger or pride of worth, then you change. So it's not just a matter of we work with emotion. I mean, all theorists now, and I get on panels with them, with Judith Beck and cognitive therapy, we work with emotion, but we mean totally different things. And it's not just accepting emotion. It's working with it, your relationship with the emotion, the sequence of emotions that you go through. So we ended up, in research context, showing that in addition, you needed to productively process the emotion and you needed to facilitate people through a sequence, and that's what really led to change. So now in slight contradiction to what I've just said, I'm going to give you a global view of what EFT is sort of saying, right? Which is we're trying to help people approach feelings, right? And that is the acceptance point of view. But people are very afraid of dangerous emotions. Emotions feel dangerous, right? These are actual phrases of real clients. I'm afraid if I start crying, I'll never stop. I'm afraid if I let my anger out, I'll lose control. I'm afraid my feelings will be so painful, I won't survive. So we want to help clients be comfortable with feelings so that they can go in and explore them. Because feelings give you information. We want to help people find the valuable life in what the emotions are telling them and what's important to them. But they are afraid they will drown, right? And this is what we're dealing with, right? So now we have to understand what are emotions. If we're going to help people, why get them to the emotions? Aren't they going to drown? Shouldn't they put it in a box and put a lid on it and just leave it? I mean, that's the often mentality of clients when they come to us, right? So emotion is a complex state that results in physical and psychological changes that influence thought and behavior. So this is really saying emotion precedes cognition and behavior. At its core, emotion is connected to survival, right? To our most essential needs that have evolved to help us survive. And emotions give us information about what needs are being met and not being met. They rapidly alert us to situations important to our well-being. I'm not reacting at the moment to the door at the back, but if there's an alarm or a growl, in Canada we talk about bears, in South Africa we talk about lions, but if there's a growl, my emotions are immediately going to tell me to pay attention over there. And they prepare us and guide us to take action towards meeting our needs. My need will be safety and I'll run. Right? But emotions also, and in 1996, Ledoux wrote a book called The Emotional Brain, which highlighted that emotions basically are our primary meaning system. It's our basic mode of processing. I feel fear, it sets fear processing in action. I feel sad, it sets grieving or longing in action. So emotion is actually our primary meaning system, right? It gives us information about what needs are being met. It gives us information about our reaction to situations. And we ignore emotions at our peril because emotions organize our body whether we like it or not. So people need to pay attention to what their emotions are telling them. So people often bring up, this is more academic, but what's the difference between these words? Affect, feeling, emotion, and so on, right? I've elaborated on a metaphor, an image used by Damasio to talk about the affect system. When I'm working in therapy, I use the words interchangeably. What are you feeling? I use feeling as the most regular word, I think, but it's sort of like what emotion or your emotion is or something like that. But there's no real clear definition of these words. They're just words that were made up from the 16th or 17th century onwards. But what's helpful as an image is the affect system is like a tree with roots and a main trunk and branches, right? So when we talk about affect, we're really referring to the roots and the main stem of the tree, to the physiology, to excited, calm. That's what affect, to the very primal kinds of experiences. But then as we go up the tree, I've added that there's something which I'm calling sensory feelings, right? This is like the bark of the tree. It's rough or it's smooth, and this is, we talk about the sensory experience of it. I have a dry mouth, my shirt is smooth, and we refer to our experience as sometimes jagged or calm, not calm, but we work at a sensory motor level, right? I want to pull away and so on. So then they're the main branches of the tree. These are categorical emotions. I feel angry, I feel sad, I feel ashamed, I feel afraid. These are like the main branches of the affect system. Then there are feeling words. And there's a difference between feeling words and sensory experience, right? Feeling words are like the small branches of the tree and the leaves, which are strongly socially, cognitively influenced. So things like, I feel suspicious, I feel confident. These are complex terms, right? So we can have, I feel calm, excited, I feel jagged and rough, I feel angry, I feel suspicious, right? Those are different kinds of levels, but they're all part of the affect system. And we're trying to work to get essentially to the emotion categorical system and the affect system, not so much the feeling words, right? But all of them are important. So emotions are fundamentally adaptive, right? Emotions tell us what's personally important to us, whether things are going our way. They help us survive by providing action tendencies and automatic ways of responding. They prepare us for action. For those of you who are not familiar, but I hope by now most people are familiar with this kind of diagram, right? This comes from Ledoux in The Emotional Brain. So if we walk through the forest, we see a snake-like object, the information goes through our optic nerve to the hypothalamus, and it sends out messages. It's kind of a gatekeeper, and it sends out messages to the amygdala, which we can think of as the center of an emotional brain or limbic system. And it also sends out information to the visual system. But if we see even by the length of the paths there in blue, the information gets to the amygdala almost twice as fast as it gets to the visual system. So when I don't see the snake out there, visually, consciously, my brain sees the snake out there, sends a message of danger to my amygdala. My amygdala gives me a fear reaction, and I go like that. And after I've gone like that, I see the snake. Right? So this is the primacy of affect, right? Once in one of these lectures, talking about this, a woman came up to me and she said she was driving on safari with her children in a Jeep, or a sort of semi-closed Jeep, and she said she suddenly one occasion jumped up and shut the window, and then a snake hit the window. Right? We know more than we can say. We see more than we are aware of. Our brain reacts. It's a processing device. It's a processing system, and we process a lot of things automatically. So in the 70s, the unconscious meant the deep, dark, psychodynamic unconscious. In about the 90s, it became the automatic processing system. It's not conscious, it's automatic, but it's not a deep, dark, hidden impulse system. It's a very intelligent and effective processing system. So we see the snake, or we don't see the snake. Our amygdala gives a very sort of primitive affective response of fight, flight, or freeze, and then we carry on. The thing is, not only does the amygdala send information down the brainstem to fight, flight, or freeze, but it also sends information forward to the rest of the brain. It's been shown that the amygdala is more interconnected to more parts of the brain than anything else is interconnected to parts of the brain. So it's a strongly organizing system, and it organizes our brain. And then we see the snake, and we're already organized by our emotion system to analyze for danger. Right? Is this dangerous? And then we bring in our cognitive system. It's a cobra, it's a rattlesnake. Yes, it's dangerous. But I've already been organized by emotion to step back, to run away. But ultimately, we need to integrate emotion and reason. But we mustn't ignore the emotion system. It's giving us important information. Right? So essentially, nothing is urgent or important in life unless it's brought to our attention by affect. I don't pay attention to the door, but if there's a growl at the door, emotion is going to pull my attention there. Each of the 7 to 9 innate affects can be thought of as kind of turning on a spotlight that turns on to show us what needs cognition. But each spotlight is a different color, and it motivates different cognitions and different actions. So fear is yellow, and it says analyze for danger, or watch out for danger. Anger is red, sadness is blue, and so on. So it's organized. Affect organizes our thoughts. And we know, evidence-based wise, that when you're sad, you have more sad memories. When you're angry, you have more angry memories, right? Mood congruent memories. So our affect is influencing our cognition. And in personally important areas, affect influences cognition much more than cognition influences affect. Right? So, where does emotion come from? children are born they're wired with an affective system. They come into the world with a capacity for basic categorical emotions. We don't teach our children how to be sad, ashamed, angry, or afraid. And I've just got a new 10-week-old grandchild. So fascinating, right, to watch. How does it happen, right? But there's emotion, and my daughter is saying she can now read, what the different cries mean. I mean, I find it hard, but I mean, if you live 24 hours a day with this child, you start being able to discriminate. And it's not like that the child is born clearly expressing anger and expressing sadness. It's developing as they go along, but they're equipped for that development. So we don't teach them how to be sad or angry, but what they become sad and angry at comes from lived experience. And so we come into the world with basic psychoaffective motor programs, but then we start developing internal mental structures around emotion. We develop what I called emotion schemes, which are representations in a mental model of what you experienced and of the eliciting situation. Now, this is the most fundamental unit. It's more fundamental than a belief. It's more fundamental than an internal working model a la Bowlby. It's like I walk into the room, I see you, and it evokes an emotion scheme. It doesn't evoke, I am afraid of abandonment, I see you as abandoning, and therefore I feel sad. I just feel sad. And then I start making sense of that sad. So I'm claiming that this is the very first gut response, and that's what we want to get to, right? These other things, I mean, the beliefs and the internal working models are all there, but they're much higher level processing units. And we want to get to the core. So with development, emotional experience is organized into complex affective cognitive networks termed emotion schemes, right? These provide primary meaning, they automatically evaluate what's significant for our well-being, and they carry our personal meanings at a felt sense, right? So what is a scheme? It helps to have this idea as a practitioner. I mean, it's important theoretically, but it helps to know what you think is going on, right? A scheme is a pattern of mental organization. It provides higher order experiencing. I mean, eventually I like Mozart, but I don't like Bach. I'm not that musical, actually, but that's a feeling, right? That's a very high level emotion scheme or set of schemes that are being activated. But we have preferences that we develop, and they're very important. A scheme is a set of components linked together in a network. Neuroscience tells us that neurons are interconnected within complex networks. So a scheme is a neuronal network. They're located at different levels, but the important thing for therapy is these networks or connections can change. It's a different picture theory, right? To think about what's going on. There's all this stuff going on internally, and my brain reads what my body does and what I'm experiencing, and it forms networks, right? And we're somehow trying to get, not our hands on, but we're trying to access and activate those networks and then introduce novelty into them, right? So if we look at a picture now, a static picture, here are the network connections at 3 months. There are hardly any connections because there hasn't been a lot of experience. By 3 months, there's more. By 15 months, there's more. We're forming these schemes, which are internal mental structures, and they, when they're activated, produce experience. So to look at this heuristically, I mean, this is not what an actual scheme is like, but I develop a scheme of fear of disappointing or failing in relation to my mother, right? What happens is I'm playing a game and I'm putting round blocks in a round hole, square blocks in a square hole, but I'm doing it wrong, or I'm not getting it right? My mother pulls a face of contempt, right? It's been shown that we actually socialize our children with facial expressions of contempt. We no longer hit them. We say, no, that's not good. That's puchi. That's bad. No. But the child is wired to read the face, right? So it's a whole communication that's going on. So there's the visual image of the mother's face, and the child begins to build an internal representation of this. Then eventually, and I've done this with my grandchildren, I get frustrated after the 10th time, and I push the child's hand to the right. I'm just being helpful. I push the child's hand, right? And the child feels the brusqueness, the sort of roughness of it. Then there's a sensation and feeling in response to the face and the push, a sinking in the stomach. This is all being coded by the brain without language, right? There's a heart rate. The child's heart rate increases, right? This is all coded. The breathing changes. There's an action tendency from the emotion to shrink away. So this is all part of building an emotion scheme. And then what comes last is something in language, right? A belief, I'm going to fail an expectation. Either the mother says you never get it right, or the parent says, you're stupid, or the child just builds this themselves, right? But notice that the belief is a symbolization in words of a lived experience. The belief doesn't produce the experience. The belief is a consolidation in language of the lived experience. So we're not working with the cognitive representation of belief, we're working with a whole bodily felt experience, right? So a difference between emotion schemes and cognitive schemas, right? An emotion scheme evaluates, is something good for me or bad for me? Do I like it or not like it? A cognitive schema a la cognitive therapy evaluates if something's true or false, right or wrong, error or truth, appraisal. I want to work in the domain of emotion, not in the domain of is it true or false, right? So when clients go to things like, is it, yes, you're right, no, I'm really, it's like, but what does it feel like? I mean, that's a primitive form. But they're different domains. There's a domain of true and false, which is truth appraisal, and there's a domain of value appraisal. Is this good for me or bad for me, right? So emotions ultimately are action and experiencing producing structures, right? We activate an emotion scheme of shame. The output of that emotion scheme is a sinking feeling in the stomach, a tendency to shrivel up and pull away, right? No language. Then we can language that with, I feel ashamed. And emotion schemes are active. They're always seeking to apply. So if I'm shame-based, when I walk in and I see you and you look at me, I'm looking for places that are potentially shaming and I feel activated. So essentially I've developed what I call a dialectical constructivist theory. We have two fundamentals, and this is a way of looking at people, right? And it influences how I'm perceiving or construing what is happening and what I'm doing, right? We have an affective system. It's pre-symbolic, not in language. And affect regulation is a core process, but that doesn't mean down-regulation. Affect regulation means having the right emotion at the right time. And then we have a meaning system. So we have conceptual processing and experiential processing, two different systems. They're both important parts of who we are. So when you come in, I'm looking at you in terms of what do you feel and what meaning do you make of it. And there's the interaction between these two systems. And some people, many people, come in only in their conceptual system. They just talk about the meaning of it all, but they're not really engaged. The experiential system is not really engaged. So we just need to look at meaning for a moment as well. I've talked about what is emotion, but now what is meaning? So really, we're organisms organize. We're always trying to make sense of, right? Meaning is actively created by people as they experience new things, right? When they experience things that challenge their way of seeing the world or being in the world, they go through a process of making meaning, right? So experience forces us to engage in new meaning construction. We're also born with a will to meaning. We have to make meaning. So when you come in, so if we dropped a little mouse down here, two things would happen. The mouse's heart rate would start increasing and it would have an affective reaction of fear. And then it would start looking around and searching to find something. So it's making meaning, right? It's making meaning of the situation. And it's not so reflective, but so are you when you come in, right? You're like the mouse. You've got an affect system and a meaning system. And they both get sort of activated, and that's what I'm working with, right? And we're born to create meaning, and we're born to create differentiations, right? That's like in wine tasting. The brain does that. It just does it. You can't stop it. And also it makes narratives. So the brain makes up stories. And we use language to shape personal experience. And our first narrative is a non-verbal, imagistic narrative of our feeling of what happens. I'll unpack that. But what I'm amazed by is my current grandchild is still too small, but at 3 months or 6 months I can remember, and of course I had children before grandchildren, but you know, carry my grandchild on my shoulders and they'll ride me like a horse and point. I've got to go in that direction. They have meaning. They have no language, but they still have meaning. So we shouldn't think of meaning as based in language. We create meanings long before we have language, right? So Damasio writes that knowing springs to life in the feeling of what's happened when changes in the body status are felt and connected to environmental impacts. To try to unpack that. First stories were constructed by pre-linguistic humans, right, who coded experience into something like, you throw a stone at me, it hits my body, and that hurts. They have no language, but they still create meaning, right? So we have an implicit meaning-making system that's not dependent on language. Now, psychotherapy is all about trying to language things. Well, it's not only that, but but it's important to understand that there's meaning. There's meaning in emotion, but there's meaning in meaning, but it's not in language necessarily. And it's through the storying of affect that we come to know what's happened to our body. I mean, our body is our most precious way of being in the world. And we code, our brain automatically, not thinkingly, codes what happens to our body. As soon as somebody comes close to us and touches us, our body codes that, and it codes our reaction, and we're hyper processors of what happens to our body, right? So you throw a stone at me, it hits me, and I make meaning of it. So meaning was created long before language. Experience is organized into stories that have beginnings, middles, and ends, agents, actions, and intentions, right? So there's a whole meaning system that is going on, and it's not just what you consciously say, and we're trying to get at those meanings as well. So we're working with both the affect system and the meaning system, but the meaning system can also be pre-linguistic, right? So how are emotions generated now, getting a bit closer to clinical relevance, right? A standard definition of the generation of emotion is, and this is going to become relevant later, appraisal of situation in relation to need, right? So my brain appraises, it's not an automatic thought, it's not I think you're looking at me rejectingly, it's my brain appraises your facial configuration without language, and it appraises it as dangerous, and I react, right? But notice the cognitive therapy theory is you have an automatic thought and that produces an emotion. I'm saying you have an automatic appraisal, but it's not in language. But that's not what produces emotion alone. It's my appraisal of the situation in relation to my need. So I appraise you as dangerous in relation to my need for safety. But if I don't feel at risk, if I've got armor, emotional armor or physical armor, and I see you as potentially threatening, it's like, who cares? So emotion is generated by appraisal in relation to need. So every emotion includes a need or an appraisal of a need. So when we're working with emotion, we're not just working with emotion. It's not just you feel sad, but it's you feel sad because your need for closeness has not been met. You feel afraid because your need for safety is not being met. So emotions are telling us what needs are being met or not being met. And we don't just say, you feel sad, but it's you feel sad that something is not happening or is happening or whatever, right? So we're going to work with emotion plus need. And there are more aspects. When I'm working with you and I want to unpack an emotion, right? I'm working to try to, what we would call exploring an emotion, right? There are different aspects in the scheme. There's the situation, what triggered the emotion. There's the meaning of the situation or of the emotion. There's the sensation or feeling of the emotion. There's the need embedded in the emotion, and there's the action tendency of the emotion. So, a man comes in and he sits down and he says, I went out on a date last night and I just can't get on with women because I have a bad relationship with my mother, right? He's giving us the situation. He's giving us the meaning. We have no idea of what the sensation or feeling is. Is he frightened when he's sitting with this woman? Is he angry? Is he ashamed? We need to go to what's missing to try to help deepen the experience. What's the need? What's the action tendency? We need to focus on those aspects that are missing in the given narrative, right? So another person comes in and she sits down and she says to me, I just had a fight with my husband last night. I ran out of the house, I slammed the door, and I went down the highway at 150 kilometers an hour. She's telling me the situation and the action tendency. What I need to say is, so you had this fight and you slammed the door and ran down, and I imagine you felt, we take up from the context what that feeling might be, or you needed him to listen and it felt so invalidating to you that you just felt so unseen and you ran out the room. But you focus on the pieces that are missing. And then when the scheme is more fleshed out, suddenly the experience becomes activated. Because an emotion scheme is an action and experiencing producing structure. And when you've touched enough and primed the nodes, the network starts firing, and whoops, you suddenly feel the actual emotion, right? Last case, a woman comes in and she says, I've got all this stuff rushing up inside of me, this red hot fluid, and it's going into my head and I'm going to explode, right? She's just giving us the sensation and the feeling. We don't know what triggered it, we don't know what the meaning's involved, we don't know what the need is. And those are the things we need to focus on, right? So if you think about fleshing out, exploring, go to those pieces that are missing, and that will help activate the emotion scheme.